Hello, my name is Dhody, and here with me today is Gabriella Nelson. Welcome to the virtual tour of Designing Motherhood at the Mütter Museum. Designing Motherhood offers an unprecedented exploration of the human reproductive arc through the lens of design in many different formats and media. Thus far, it is a book, a public program, a design curriculum, an Instagram account, and an exhibition. Most of all, it's a collaboration. The exhibition is part of a larger project envisioned and facilitated by Maternity Care Coalition, an organization that works to ensure that families can birth with dignity, parent with autonomy, and raise babies who are healthy, growing, and thriving.
Birth is a universal human experience. At some point in life, each of us will repeat, prevent, rethink, or reject this process of reproduction, and in doing so, will interact with tools, techniques, systems, and customs to make or break these cycles. Design impacts every one of these, from the intrauterine device that prevents the process of fertilizing an egg, to the midwife who advocates for culturally appropriate care. Some of the objects and systems in this exhibition are the product of previously guarded medical knowledge, while others were shaped by dire need and collective political will.
There are 5 stories in this gallery: means of reproduction, midwives, parturition, exam, and milk. Some of these designs remain taboo, rarely considered, and inaccessible to many. Designing Motherhood invites you to consider why and how designs were developed to facilitate reproductive health, and to ponder the political, economic, and social implications of medicalized reproduction. These are not just women's issues, they are human issues. Tools to monitor reproduction and control fertility have been developed not only by medical professionals and designers, but activists as well. Social movements have helped both shift legal and social restrictions and ensure duties of care related to reproductive health. These efforts are ongoing and remain the subject of political and cultural discussion.
The first selection of objects in this section are IUDs, intrauterine devices. Small, variously shaped, and usually made of polyethylene or copper, IUDs are inserted in the uterus by a medical professional to prevent the process of insemination and implantation of an egg, and thus pregnancy. They offer a reliable method of contraception. Today, their design is regulated in great part because of one particular IUD, the Dhody shield. Before being discontinued, it was administered to around 2.5 million women in the United States and Puerto Rico in the early 1970s. Its removal string was multifilament, allowing bacteria to enter the uterus like a wick. The Dhody shield caused widespread pelvic inflammatory disease and subsequent infertility. To the left are 2 popular modern IUDs, a Mirena and a Paragard. They feature a single filament removal string to prevent complications like those caused by the Dhody shield.
Next, we have an artwork by Martha Pagoli titled Incomplete Patent Chronology 1838 to 2021, Scheme A61F. Each object in this timeline depicts a patent claim related to IUDs, pessaries, and other devices related to reproductive health. The drawings represent proposed inventions, some of which were never manufactured. Others may look familiar as actualized objects in the exhibition. While most of the patents in the map are from the United States and the United Kingdom, online databases containing such patents continue to expand, so the map will continue evolving in the future.
In this case is a first edition copy of Our Bodies, Ourselves, bearing the original title, Women in Their Bodies. First distributed in 1969 by the Boston Women's Health Group, it was developed for a community organized class, but was reprinted again in 1970 for wider distribution. A Spanish edition aimed at U.S. audiences was also published in 1977. Versions of the book produced for different countries and cultural contexts grapple with a range of issues. The most recent was published in 2011. It's over 900 pages long and is more inclusive of varied gender and sexual identities. Next, we have a film by South Korean artist Curator titled Born, Unborn, and Born Again. This art film opens with the artist attending a 2019 public celebration of the repeal of abortion restrictions in Seoul, South Korea. The artist's affirmation of this milestone of reproductive justice is quickly complicated by her ensuing exploration of her own gestation 30 years ago in a culture that prizes male babies, which was carried to term because the ultrasound misassigned her biological sex. Made in the United States, a country with more and increasingly restrictive abortion laws than the country in which she was born, John's film explores the transnational nature of governmental control over reproductive systems, switching between Korean and English as a way to signal ruptures and repetition of time.
Today, most people give birth in a hospital with a team of physicians. But until the 19th century, many aspects of women's reproductive health took place at home, largely attended by midwives from the local community. In the United States, the practice of midwifery was rooted in shared skills and wisdom, especially the expertise of Indigenous and later Black women. Likewise, immigrants to the U.S. brought midwifery and home-based healthcare practices from many cultural backgrounds. Gradually, modern medicine claimed that such matters were the preserve of hospitals, which were predominantly staffed by white male doctors. The United States currently has the highest rate of maternal mortality in the developed world, which skews even higher for Black and Indigenous populations. Only 10% of U.S. births are midwife-attended, compared to more than 50% in other high-resource countries. While there are certainly circumstances of birth that require a physician's insight, the WHO and other international global health experts recommend that a simple way to improve maternal and newborn outcomes, reduce the rate of unnecessary interventions, and realize cost savings is to increase the role of midwives in American medicine.
First in this section is All My Babies, a midwife's own story. Released in 1953, it was designed as a training aid for midwives and other health professionals at a time when birth was moving from the home to the hospital. Commissioned by the Georgia Department of Public Health, filmmaker George C. Stoney shadowed midwife Mary Frances Hill Coley for 4 months in Albany, Georgia. It depicts the critical role of Black midwives in communities across the American South. While some acting was involved, it was shot on location in actual homes and medical offices. The film centers on 2 actual births that Coley attends skillfully and with high standards of hygiene. A product of the Jim Crow era, it records the uncomfortable and enforced deference of Black midwives interacting with white doctors and nurses at the county clinic. Coley even questions her own excellent hygiene practices after a group lecture by a white doctor. All My Babies foreshadows the demise of Black midwives who once provided critical care for poor and rural pregnant women of all races throughout the American South. It offers a rare glimpse at how Coley's model of care once coexisted alongside the growing medical industrial complex and managed to function within a racist medical system.
This small bag and contents is the Janma Clean Birth Kit. According to the WHO, more than 800 people die every day in pregnancy and childbirth from preventable causes such as sepsis and other severe infections. After encountering a midwife in rural India who did not have access to sterile tools, mechanical engineer Zubaida Bai created an improvised clean birth kit for under $2. She calls it Janma, which means birth in Sanskrit. Each kit contains off-the-shelf tools to create sterile birth conditions: an apron, a sheet, antiseptic soap, a cord clip, and a surgical blade. In 2010, Bai founded healthcare company Eyes, which has distributed more than 250,000 kits, reaching 500,000 birthing people and babies.
Our next object is part stethoscope, part ear trumpet. The pennard is a simple horn-shaped object made of wood or metal. When the French obstetrician Adolphe Pennard designed his fetal stethoscope in 1895, the device revolutionized medicine. The pennard horn is uncomplicated, inexpensive, and unquestionably safe. Unlike ultrasound, it doesn't require batteries or external power sources, and training to use it is simple and intuitive. Although the pennard's ear is all but obsolete in the United States, its simple design is an international favorite of midwives, still used everywhere from Mali to Denmark. This example was manufactured by Miltex in Germany. Knowledge from birth workers is often passed down orally. In this case, we have a series of books on the subject. In the early 70s, a time when very little had been published specifically for families about birth, self-trained midwife Raven Lang opened a birth center in Santa Cruz, California, and authored the birth book. A potential publisher demanded that she remove all pictures of vulvas and bottoms, so she chose to self-publish instead in 1972. We chose this example for its striking cover design and significant content, but there are many other 20th century birth workers with equally important wisdom to impart. We urge you to seek out their resources on your own.
Parturition is the process of delivering a fetus and placenta from the uterus to the outside world, whether this process is vaginal or by cesarean, at home or in a hospital. It is surrounded by designs that vary according to culture, politics, and economic situation. Spanning centuries of innovation, all the designs shown here were invented for a medical professional to deliver a living baby without removing any body parts that should remain inside the birthing person. With modern medical advances, designers today can focus on the needs, comfort, and agency of the parent, rather than just safety and ease of use.
In this case, we have a selection of 32 pessaries dating from the 18th century to today. A pessary is a device inserted into the vaginal canal to support descending organs. Pelvic organ prolapse is a very common condition caused by weakening of the pelvic floor muscles, which allows the pelvic organs to descend into the vaginal canal. It affects over 50% of people with vaginas over the age of 50, and while it is not life-threatening, it can be life-altering. Despite its prevalence, most people are unaware of prolapse until their diagnosis for reasons that range from underinvestment in design for women's health to social stigmas about reproductive health. In the past, pessaries included objects like pomegranates and balls of wool, which were often difficult to insert and remove independently. Today, some are made of silicone and geared towards ease of use. An all-female design team at Rhea created a pessary that collapses to half its diameter for easy insertion and removal. Their goal, which will be tested when it goes to the market next year, is to offer an approachable design that provides its users dignity and confidence.
In the next case, we have 3 sets of forceps. Forceps are used to assist the birthing process by grasping, holding firmly, or exerting traction encircling a baby's head. Although vital for some high-risk births, the use of forceps has always been controversial. The tool was invented in late 17th century England by the Chamberlain family. They marketed their midwifery services based in part on this invention, which was kept a family secret for over 100 years, the intellectual property providing them monetary gain. In this case, we have a model from the 19th century. Eventually, they sold their design, allowing medical providers to improve it with innovative modifications. Scottish obstetrician William Smellie separated the blades for more comfortable insertion, and in some cases, concealment to prevent fear and panic, though this meant the forceps were used without the patient's consent. He also wrapped leather around the blades, believing that this would reduce the temperature difference between the steel and the body. However, the absorbent material could not be properly sanitized between uses and thus posed a dangerous risk of infection. Our last example is the early 20th century Dhody forceps, made entirely of autoclavable steel by Lawton of Germany. These represent the modern stage in the development of forceps. The handle shape provides traction while maintaining Smellie's improved design of separated blades.
Next, we have 3 perineal repair simulators. The perineum is the area between the vulva and the anus. It can tear during birth or be intentionally cut to hasten the birthing process. This cut is called an episiotomy. Dr. Adam Dubrowski is part of a team that creates medical simulations for training purposes, including these 3D printed perineal repair simulators. The team designed inexpensive open source files showing perineal tears of different depths and severities, allowing anyone to print a simulator. They chose the hot pink color to avoid racial or ethnic biases. Around 1/3 of all postpartum people in the United Kingdom and United States require stitches for a torn or cut perineum after childbirth. Perineal lacerations can cause severe discomfort and incontinence, so skilled suture repair is essential.
While designers have given us methods to monitor and safeguard our bodies, some examination instruments in this section were developed through procedures now recognized as unnecessarily painful or without patient consent. The tools here have moral and ethical dimensions. Instead of designing examination protocols that only serve practitioners, new tools and practices are designed to benefit patients as well. This promotes inclusive and accessible patient-informed care practices for pelvic exams that embrace the diverse experiences people bring with them to medical settings. These prints are from a book titled Table Manners, a guide to the pelvic examination for disabled women and healthcare providers. Published in 1982, the book was written by 2 people who self-identify as physically disabled women with experience in the fields of family planning, education, and counseling. The authors argue that disabled people deserve accessible, quality health care that is informed of their needs. These illustrations by Ann Waltzer show how patients and providers might collaborate to make thorough pelvic examinations as comfortable as possible for everyone.
Next, we have a set of speculums. Speculums are an early diagnostic tool used in examinations of internal orifices. Modern speculums are designed for specific anatomical features, but that's not the case for this 19th century reproduction of an ancient Roman quatrevalve speculum found at Pompeii, which would have been used for both vaginal and rectal exams. The next speculum was designed by 19th century American physician J. Marion Sims, often referred to as the father of gynecology. Among his innovations are a method of repairing the fistula, a condition in which a hole develops in the birth canal between the vagina and rectum, uterus, or bladder as a result of childbirth. Although his work improved women's health, his major successes involved experimentation on 12 enslaved African American women during the 1840s. By virtue of their enslavement, they were incapable of consenting to their many surgeries, mostly without anesthesia even after it became available. Some of these patients' names are known: Betsy, Anarcha, and Lucy, prompting obstetrician Camilla Phillips to rename Sims' speculum the Lucy speculum in 2020. The final speculum on display is a 2019 prototype of the Yona speculum by the San Francisco-based design firm Frog. 4 women developed this design by first questioning why the speculum has not changed to better serve patients in the 21st century. They meticulously evaluated the materials, efficiency, ergonomics, and even auditory features of existing designs to improve the tool and thus the pelvic exam experience. As Frog puts it, it is designed for people with vaginas by people with vaginas. Our next object is the Nisa Vi-Vision Between the Legs Self-Check Mirror. With the tagline, "Get to know your vulva in a whole new light," this hands-free mirror was designed to rest between the thighs in a seated or standing position. While a hand mirror may work, it requires uncomfortable positioning that can distort the user's anatomy and obstruct the view with shadows. Designed in 2018, this mirror features an LED light providing a clear and unrestricted view of the user's anatomy, which Nisa's founders suggest can be used for routine well-being checks, self-grooming, or to guide the insertion of a menstrual or contraceptive device.
WHO guidelines encourage breast milk as the preferred source of nutrition for infants through at least 6 months of age. Although this recommendation respects the cultural and economic realities for many, for some it is impossible due to individual well-being or the absence of appropriate public or workplace accommodations. In the United States, almost a quarter of postpartum people return to work within 10 days of giving birth, which is nowhere near the 6-month recommendation. The designs displayed here may appear to ease feeding, but they do not show the time and labor involved, which often falls on women.
Our first case in this section shows a series of breast pumps. The earliest model is the Phoenix breast pump, produced by Whitall Tatum in 1879. At the time, breast pumps featured a glass bulb with a rubber tube attachment that either connected to a hand pump or a single straw that would go into the user's mouth to create suction. These devices were sold in science glass catalogs alongside pharmacy bottles and chemistry equipment. A more modern model is the 1956 Egnell SMB breast pump. Swedish civil engineer Einar Egnell was one of the first to design breast pumps based on observing human anatomy rather than bovine subjects. The resulting breast pump was named for Sister Maja Kinberg, a nurse who collaborated on its testing with new mothers in a Stockholm maternity hospital. The most recent item in this case is the 2021 Willow wireless breast pump, first released in 2017. The at-home electric pump was not developed and widely marketed until early 1990s. This particular model is designed to be worn in the user's bra for hands-free use and conveniently comes with a smartphone app. While the 2010 Affordable Care Act mandates that health insurance must cover the cost of breast pumps, it's worth noting that most modern models can cost as much as $500. Federal law requires that businesses provide lactation breaks and dedicated spaces for pumping, but many workspaces still lack adequate facilities. As MIT's Make the Breast Pump Not Suck hackathons in 2014 and 2018 highlighted, the very existence of the breast pump exposes the pitfalls of insufficient family leave, which would provide for a much more holistic breastfeeding experience.
Finally, let's examine this set of nipple and breast shields. A nipple shield is a sheath worn over the areola and nipple during breastfeeding. Modern nipple shields are made of soft, thin, flexible silicone and have holes at the end of the nipple section to let the breast milk pass through. They provide a larger surface for the baby to latch onto and can offer protection for the nipple if it gets sore. These 18th and 19th century examples serve similar functions. One is made of boxwood, while another is made of pewter, which modern testing has revealed contains lead, posing a hazard to both the feeder and the infant. This glass design was meant to catch milk under clothing while not feeding, and features a hole to empty the collected milk.
In contrast, we have a set of dress flanges created by jewelry designer Mary Ife. Shortly after becoming a new mother, Ife received an invitation to create work in response to the Mütter Museum collection. She was inspired by Mercer's collection of butter prints, which vendors use to decorate and distinguish their butter pats from other vendors, and designed these to adorn the parts of the pump that attaches to the breast. Rather than conceal the production of milk, as is often the case with breastfeeding, I felt a kinship with these designs that allowed this essential aspect of motherhood to shine.
Thank you for joining us on this virtual tour of Designing Motherhood. While the exhibition is no longer on display at the Mütter, it will be visiting other institutions in the future. Follow @Designing Motherhood on Instagram for updates on its travels. Please like, comment, and subscribe if you'd like to see more content like this. Major support for Designing Motherhood has been provided to Maternity Care Coalition by the Pew Center for Arts and Heritage. Additional support has been provided to the College of Physicians of Philadelphia by the Pennsylvania Historical and Museum Commission, a state agency funded by the Commonwealth of Pennsylvania, and the Groft Family Memorial Trust.